Chapter 37, Thrombosis, Hormones and Pregnancy. This is the second training for the Thrombo sensor genetic test, and it only has relevance to women. So for men, this is not a relevant information. So let's look at hormonal therapy and genetics. If a person or if a woman has all genes that are functional, so that she does not have an increased risk for thrombosis due to genetic variations, and this woman takes hormones, either as a contraceptive pill, any other form of hormonal contraceptives, excluding the condom. Condoms do not have any hormones, or the hormone replacement therapy, which women usually take after, or sometimes take after menopause to combat the symptoms. So if good genes combine with hormones, the risk of thrombosis is usually twice as high. And this is something that women should be aware of, that their risk is increased. However, this is a risk that most women willingly take due to the benefits of using these hormonal preparations. If you use, or if women with normal genes use it for 20 years, only one in around 250 will develop a thrombosis due to this combination. Now it becomes more complicated if you have a genetic variation that predisposes you to thrombosis. So if only one of the genes of the factor V gene, for example, is defective, and hormonal replacements are taken, hormonal preparations are taken, then the risk is 15-fold. And you might remember from the training of the thrombosis genetics, if the factor V gene, one of them is defective, the risk is 8-fold higher. And here it's only 2-fold higher, so these two multiply with each other. And 1 out of 20 women has this genetic variation, so it's a common problem. And 1 in 27 is going to develop a thrombosis during those 20 years of using the hormonal contraceptive, for example. It becomes even worse when both factor V genes are defective and you combine it with hormones, because then your risk is more than 100-fold higher. Only 1 in 200 women has this genetic combination, so it's rarer, but if you have it, it's a 1 in 6 chance that you will develop thrombosis over the course of these 20 years. So really what doctors should do before prescribing a hormonal contraceptive or a hormonal replacement therapy, they should check out the genes, because if the genes are of the detrimental genetic variation and they combine it, their risk of developing a thrombosis are very high, and it should not be combined. Now, in terms of pregnancy, thrombosis is responsible for 1/3 of all deaths that occur during pregnancy. This might either be miscarriage, where the woman loses the baby, or the death of the mother. And there are around 200,000 cases per year worldwide where women die due to thrombosis. 60% of these cases are caused by genetic variations. So 60% of all thrombosis that occurs in pregnant women have a genetic basis that we can test for, which means 120,000 mothers die every year due to genetic variations or genetic defects. And there's a very effective treatment. Heparin is effective treatment against thrombosis, and it is safe for the embryo. It cannot cross the blood to fetus barrier, which means it remains in the mother's blood and does not even reach the embryo, and it reduces the risk significantly. So if we look at a woman with normal thrombosis genes and pregnancy, her risk is 4-fold. If she has one defective gene or one genetic variation increasing the risk, and she's pregnant, her risk is 60-fold, so significantly higher. And with 2 defective genes, her risk is 160-fold. So really what should be recommended, since 60% of all thrombosis fatalities are in these categories, they should be treated with heparin, because that reduces the risk to even below that risk of a person with no genetic variations. And this is the recommendation of what we would make based on genetics. And this is how it is done today. When a woman comes to a doctor, gynecologist, he asks, so do you have thrombosis in your family? And she might say, yes, my grandmother had thrombosis. If she says no, then usually the doctor would prescribe the hormonal contraceptive. However, if she says, yeah, my grandmother had thrombosis, then he said, oh, family history, that's too risky. Let's not use hormonal contraceptives. Now, let's see if this is actually the correct approach. So if no family history, everything's okay. If there is a family history, they don't get the drugs. Now let's look at what must happen if the grandmother has a genetic variation, that the woman that has gone to the doctor actually has this genetic variation. So the grandmother has one mutated gene and an 8-fold risk and has developed thrombosis. Now there's a 50% chance that she will pass it on to her son, because she will give one of these two genes, 50-50 chance, which one will be passed on. And in this case, let's say the 50% chance has been passed on. Now the father has it. And the father, again, has a 50% chance to pass it on to his daughter. The daughter is the girl that wants to go to the doctor and wants the hormonal contraceptive. So you have a 50% chance and then a 50% off a 50%, so a 25% chance that this woman has actually inherited the gene that the doctor has heard about in the family history. So the result is the likelihood that if the grandmother had a genetic variation, that she has inherited it is 25%. So 75% of all women who receive no hormones due to this family history, where the doctor says if it was in a grandmother then it's too risky, 75% of all women have no genetic risk, even though it was there in the family history. And this is the problem of looking at the family history, because everyone only passes on half of their genes. So really a family history is a very sketchy look into the genetics of a person. So if you say family history has a thrombosis case, it can be up to 75% false not to give this woman a hormone contraceptive. And if you say family history is okay, it might also be wrong, because this person might have inherited it and just the family history hasn't shown the results. So really looking into the family history is not a good genetic test. That's why most doctors like to do a genetic test, because that gives you a definite answer rather than an estimation. So do a genetic test instead of family history, find out if there's a predisposition. Don't use hormonal contraceptives if everything's okay. It can be used without a problem. And this here is one of the genes. If this table doesn't mean anything to you, please do watch the training for simple disease risk statistics that will explain it all to you in more detail. GG genotype, 96% of the population have this genotype. They have no increased risk. 3% have the AG genotype. Actually, some studies say 5%, so it's around 1 in 20. Odds ratio of 7, some studies say odds ratio 8. And 1% have an odds ratio of 80. And this here is the science behind it, in case you're interested. That's the second gene. So most people have no increased risk. 3% have an odds ratio of 5, so 5-fold risk compared to people with the optimal genes. And 1% have a 25% risk. And that's the third gene, slightly less high risk, 1.83, 1.84. And the MTHFR gene, 9% have a genetic variation that increase the risk 3-fold. Now, what we can do is we can do the genetic test, we find out your risk, and then it's all about preventing the disease. And you will get a very, very nice explanation of what preventive steps should be taken. And I will just quickly summarize it for you. It will be in every report, so it's a good idea to read through it once. But generally for high-risk cases, during long flights, when people sit for 10 hours, it's recommended to get up every now and then. This will remove any small blood clots that might have formed and prevent larger blood clots to to be produced. Then heparin injections as a precaution measure. You might get, or people in risk situations would get heparin injections from the doctors just before the flight, and this will then reduce the risk of developing thrombosis. Then there are some certain anti-thrombosis stockings, so something you can wear. They compress your feet and help prevent the development of thrombosis. Then regular exercise reduces the risk of thrombosis. Smoking, as I said, is a very big risk factor. It should be avoided. Drinking a lot of fluid keeps the blood very dilute and less prone to produce blood clots. And aspirin or clopidogrel have a preventive effect in causing a blood clot. However, aspirin has only been shown to be beneficial in certain genetic cases. There's a genetic variation which abolishes this protective effect. So it's effective in some people and not effective in other people. And especially in women, if you have a higher risk, no hormonal preparations unless it's also combined with a blood thinning therapy, and heparin treatment during pregnancy is recommended. So this is the prevention and has a very high chance of reducing your risk and preventing the person from getting any thrombosis. And the other aspect is better treatment. There are drugs which are blood thinners which prevent thrombosis from occurring. And these drugs are metabolized by the body. So in case you don't know much about it, there is a training for the pharmacosensor that will teach you everything about how drugs are metabolized, how they can cause side effects or no effects in some people. Basically, when a drug is metabolized by a certain gene, then it works, and if this gene is defective, then the drug might not be broken down, like in warfarin, which is a common blood thinner. If you then take it once a day, in the end you get excessive bleeding or uncontrollable bleeding as a side effect, because you have so much of your drug in your body because the body could not remove it. So what we can do is we test all of these genes and we can estimate the breakdown of every drug. And then you get a list saying this drug is broken down 50% of the speed, which means you should only take 50% of the dose. Sometimes you find out this drug is very likely to cause side effects, so don't use this drug and use an alternative drug. So we can really find out the right drug, we find out the right dosage, and thereby help you to get the right treatment in case you have an increased risk, to make sure that no thrombosis occurs. And this is the end of chapter 37 for thrombosis, hormones and pregnancy as additional training for the thrombosensor.